Hi, and welcome to the Healthcare CEO Show, where you'll find actionable insights on healthcare leadership from the best and brightest in the industry. I'm your host, Daniel Fernandez. Let's get a pulse. And with me today, I have a very exciting guest. Her name is Ingrid Lindberg, and she is quite literally the world's first CXO. Ingrid literally has more experience than anyone else on the planet, having over 20 plus years of it. She's also worked with global brands across all of the Fortune 500 industries. Thank you for joining us today, Ingrid. So before we get started, tell us, how did you become the first CXO? What does that story look like? And how do you ultimately become a big, badass CXO?
Okay, so there's like the 4-hour version, but we're going to give like the minute-long one, which is I walked into a CIO's office in 1997 when we were building a tool for literally people to do trades online, right? We were taking financial services online. And I said, hey, I think that there's a way we can do this better. And he looked at me and he said, are you a UX designer? And I was like, no, what is that? And so then he sent me to school. I got to learn a bunch of stuff about how to design things between humans and computers. And then frankly, you know, when you're the person who understands how to do that, people say, oh, well, if you can figure out how a human can talk to a computer, then you could probably write a letter. And I bet you've got some ideas about how someone should answer the phone. So I just kept adding channels and got known for doing some pretty cool design stuff in products in financial services and healthcare. And then in 2007, the CEO of Cigna, David Cordani, called me and said, hey, I'd like to give you this job. I'd like you to be a customer experience officer. And I'll never forget. I was like, I don't know what that means. So I should go and I should look it up on LinkedIn. So I went to LinkedIn and I typed in customer experience officer and there were no results.
No results.
0. So then I typed in customer experience and there were 2 results. Today, there's something like 16.5 million. Wow. So that's between 2007, November of 2007 and today. How nuts is that?
So you're literally the OG. I guess they're OE, right?
OE, OG, I don't know. I get OG an awful lot when I'm walking up on stages. I tend to wear a lot of skulls and a lot of black stuff. So, you know, the OG works too. But
wow. So, I mean, you know, over 20 years, so much must have changed. I mean, are there any things that really stood out that kind of moved experience forward, you know, that were sort of catalysts for changes, or what are some?
That's a tough one, right? So let's kind of just talk about healthcare. I think healthcare experience is an interesting kind of box. Is that fair?
Let's do that.
Let's do that, because there's a lot of stuff that's happened, right? So I think in healthcare, and you know, if you read anything about me on LinkedIn, I'm going to say this now, and people either love it or hate it when I say this. So I built the first health savings account, right? So I introduced to the US this kind of idea of consumer behavior in healthcare. And, you know, we did that in the late 90s, early O's. It was a long time ago in a galaxy far, far away. But what that did was it really made people start paying attention to what was happening within a service that they hadn't spent a ton of attention on up to that point, right? So now I had to open my wallet and I had to pay for things, which meant I had a much higher expectation level. And I think if I have to pinpoint one thing that's really changed how consumers interact with healthcare in the US in the last 20 years, it's probably the advent of that, because that made people think of it as a service and a good for the first time pretty much ever. That's at least my humble opinion.
Right. Which makes perfect sense. Is there, you've worked with so many clients. I mean, are there any stories or a story that really resonates with you even still today that you remember from over the years?
Oh my goodness. You know, there are things like I was working with a large insurance company, right? So they've got 65,000 customers across the globe. You know, they're in like 30 some countries. And it was amazing because the intent was always so good, right? The intent was always so good. And what was crazy was they just weren't available to help people. So they were really hard to do business with. And we did a lot of work to make doing business with them easier. That's one big story that kind of is always stuck in my brain, was how do you actually take years and years of process and procedure, a lot of which was required, right? Was required, and remove it so that you could serve people better. The one that always kind of makes my eyes water a little bit though is I did some work with a children's hospital several years ago. And one of the things that we had figured out was, frankly, they were getting sued an awful lot. They were getting sued an awful lot. And one of the reasons they were getting sued was because when doctors were trying to resuscitate children, they would make the parents leave the room.
Oh my gosh.
And this, it can bring me to tears today, right? And we said, let's let parents stay, because the heroics that happen in those moments are something that I don't think we should shield people from. Right. So the intent behind the change in the experience was frankly started because of the litigation. But the outcome of it was parents actually seeing what really happens and how hard people will try. And I think that's kind of a great frame for healthcare, right? We've done so much to kind of hide stuff, whether it was for the right reason or the wrong reason. And when you open it up, people can be really responsive to how decisions are being made. You just have to be a lot cleaner about it. I love that one. And they still do that, by the way. They still allow parents in the room.
Yeah, and I believe that in that transparency. I mean, earlier in my career, I worked in a trauma room, and when a kid passed, I mean, there wasn't a dry eye in the room, or when a kid was struggling or hurt, or, I mean, everyone wept, you know, and it's okay. It's okay for parents to see that. It's human. Yeah.
It's human, right? We're messy mortals. And I think, you know, healthcare specifically, we've created this space between the people we serve and the people that are doing the serving. Right? We call them healthcare professionals, and we call them providers, and we call them insurers. Right. There's people in this whole equation. And I think the more we open up the world to the fact that we're all messy mortals, right? And we're all very human, I just think, frankly, the better the entire ecosystem works.
Do you think there are a lot of organizations out there that may have proper intent or a proper why, but just fail in the execution?
All over the place.
All over, right?
All over the place, right? One of the things we always do when we're starting a project with a new company or a new client or a new healthcare system is we run what I call the stupid rule contest. Okay. So we walk in and we say, okay, we want to change how we serve people, right? We want to change how we serve people. And our question is to you, what stands in your way of delivering on outstanding care? Right. And I will tell you the number of holes that we can find in any entity, and it's instantaneous, right? It's like, you have this rule, you do this, you do this, you do this, you make us do this, you make us do that. And when you can start to pull those apart, it's like, oh my gosh, they were put in place for the right reason, right? The intent was always right. Right. The intent was always right. But the time has come to actually readdress, right? Yeah. The time to readdress. So I think there's a lot of great intent, but you know, there's some spot for change.
I agree. You know, healthcare in general is typically on the laggard side when it comes to technology. I think we can agree they're not exactly the first to implement a lot of things, right? But now I feel like healthcare organizations are implementing so much technology as everything's happening. One of which is telehealth. Feels as if there's be some potential barriers that are created now that we're moving more towards this like technological world, or it could impact the patient experience or just a human experience in general. I mean,
you have like 15 questions, Daniel.
Of course. Yeah, of course. Yeah. I mean, these are,
I love you.
These are, of course. Yeah. Let's maybe just break it down a little bit, you know, healthcare, technology, laggard, maybe, you know.
I like that. Right? I like that. So I think, you know, if I kind of go back in my brain, I was a part of the team at Cigna when we were actually implementing what we called virtual house calls, which was Relay Health back in 2007. So telehealth specifically has been around for a long time, right? Like Teladoc, I think, was publicly launched in 2005. So, you know, we've got 15 years of this. But there was an American Well study that was done last year that said that only 11% of people had actually experienced telehealth. So only 11% of people had experienced telehealth in 2019. McKinsey did a study in April of this year where 46% of respondents have now experienced telehealth. So you look at that, I mean, talk about movement, right? That's like, boom, there you go. We all know why it happened. Okay, fine. And whether it's happening through your iPhone or whether it's happening through a platform, right? All of them are telehealth, right? A phone call, it's telehealth. They're all telehealth. So I think, you know, it's kind of, it's like, it's out of the gate, right? Yeah. I don't have to go into a doctor's office. I don't have to wait. Right. You usually show up for my telehealth appointment on time. I get more time with you. I'm finding I actually get more time. Consumers are finding they get more time on a telehealth appointment than they do in person. Isn't that crazy? So there was a stat that came out not that long ago. So before COVID, telehealth was a $20 billion industry. After COVID, it's going to be a $250 billion industry.
Wow.
And that's assuming that only 20% of Medicare, Medicaid, and like in-house commercial stuff stays. This isn't anything crazy. This is just some chronic disease management. I mean, it's here. It's here. So we have a lot to do to clean it up. And I think the legislation is going to be key, right? There's a lot of states that didn't allow telehealth for things like behavioral. We've got to kind of start over again and think about, look, we figured out it works pretty darn well, right?
I think you've answered the question. It's no longer a fad. It's here to stay.
It's here. It's totally here. And consumers like it, right? Across all demographics. We've done a ton of research, and what we're seeing is that literally the vast majority of consumers across every single generation are like, yep, I would use that again. The things, I thought this was fascinating. Tell me to shut up, Daniel, but
no, please.
Fascinating.
Yeah.
So over 5 minutes, if the call is over 5 minutes and it's video, satisfaction is higher. If you let me speak for 35 seconds without interrupting to let me tell you my story, satisfaction is higher. And if you make eye contact with the camera, satisfaction is higher. Those 3 things, that's it. I mean, this is not hard.
It's not. Yeah.
Isn't that crazy?
I'm really excited about the future. I mean, pre-COVID, I walked into a doctor's appointment and I was handed a pen and a pencil at a doctor's office. And I was told to fill out half of the paperwork with a pen and the other half with a pencil. And I was confused, and I consider myself somewhat intelligent. But then I thought to myself, what is the average person doing as they're walking in here and being presented with a pen and a pencil? I mean, some of these changes have been a long time coming.
Oh, for sure. Right. And the fact that, we've had to fill out the same forms. I mean, we've talked about this for years, right? I mean, we've had to fill out the same forms for how many years? I remember when Freesia had first hit the market, like back in 2009, 2010, and they had that iPad in that hard yellow case, and they were supposed to be taking away like all of the hard check-in stuff. Right. And they did a great job with a lot of that. But I mean, my gosh, how many times, even in the last year, have you had to fill out a form that was paper and clearly mimeographed?
That's so true.
Scary.
Let's talk about something else, maybe a lesser discussed topic. Employees. I mean, for them, experience is changing. More people are moving to remote work environments and things of that nature. How do we maintain engagement during these uncertain times?
These crazy times that we are now in, right? That are officially here.
Right.
Officially here. So I think, there's some great things about this, right? I mean, I did a webinar not that long ago with a lot of physicians, and one of my panelists was a primary care practice owner and an urgent care practice owner. And he's up on a mountain in New York, right? He's on a ski mountain in New York. So he has a really hard time staffing people. Okay. He does. He just doesn't have enough docs, right? Doesn't have enough docs. And so he was talking about the fact that he still needs people in person at his at his urgent care. But at his primary health, he's actually working towards like a 50% telehealth visit, 50% in person. So we started talking about the employee side of it, right? And he was like, it's hard because you don't actually get to see your team. You don't get to have that huddle every morning. And I challenged him. And this is kind of the advice that I give any team leader. I have a stand up every single morning with my entire team, right? And we do it over coffee. We do it at the exact same time every day. You're not required to be there, but most people show up. It's about 15 minutes, and it's just a touch point that reminds us all that we're on the same team. That's number one. Number two is the need to communicate more than you have ever possibly communicated in your life, right? I so often say, I don't have answers. I don't have answers. I don't know when we're going to go back into the office. I don't know when it's safe for us to go back into the office. I don't know these things, but here's how I'm thinking about it today. I mean, the level of transparency I am bringing to my team is crazy high, right? Yeah. And then I think kind of last but not least is I do a lot of one-on-one touch base. Right. Because if you ask your team how they're doing in a staff call, you're going to get the exact same answer from everybody, which is okay. I'm doing okay. I'm good today, right? And there's something about being able to really read body language and faces that I don't think we've had to use before. right? You could feel it on people before. You could feel it on someone, even if they were smiling at you. You could be like, oh, I know you pretty well and something's off. So I've solved that by doing a lot of single one-on-one outreach and touches. And just being like, hey, how are you, Daniel? We haven't, just haven't checked in on you in a couple of days. Talk to me.
Yeah. I mean, that I love that. I especially love the one-on-one aspect, because in a group setting, people are just going to kind of follow suit with what everybody else is doing. But
right.
In a one-on-one environment, you can really check on their mental health, because I think that a lot of people are struggling today.
It's huge. And we all are. Yeah. I mean, we all are, right? We all are.
Right.
I think that's one of those things. We talk an awful lot about a lot of people are struggling. And I would just encourage people to say, I'm struggling, right? I had a bad day. I had a rough week. I had a tough thing happen. That just opens up a whole different level of relationship with your team.
I think there's a lot that someone listening to this can learn from that, especially a CEO or a physician. Because me personally, for a long period of time, it felt as if physicians had always created this facade, and didn't want to be as vulnerable as they could be. I've also seen the flip side of that, where physicians have been vulnerable, and people will follow them into battle. I mean, they believe in them and support them. So yeah, that's exciting. Let me talk about one other thing. Before COVID, I might not have had 100 boxes in my front door from Amazon. And I mean, there's video conferencing, right? I mean, you go back 6 months ago, what is Zoom, right? You ask the average person on the street, Zoom is, and they're like, I don't even know what you're talking about, sir. It's just, but now everybody knows. And it just, I feel as if behaviors are going to be somewhat shifting because of everything that we're experiencing right now. I mean, do you agree, or is that not necessarily the case?
So I'm so torn on this, right?
Yeah.
I'm so torn on this. So it depends on what day you ask me. I do a lot of work with a lot of CEOs around what does the future look like, right?
Yeah.
What does the future look like? And back in March, I did a futurist summit with a bunch of CEOs from Fortune 500s. And the topic that I was asked to speak on was all about work and going back to work. And back in March, I said, I don't think we're ever going back into offices. I don't think that the average white collar office worker will ever go back into an office,
right.
Purposefully way out there, right? Purposefully way out there. So I'm not sure what we're going to look like, but I know we're going to look different than we did before, because there's not a go back, right? There's not a go back. The freedom, the Zoom towns that are popping up all over the US, right? People saying, I don't have to pay this much money to live in New York or in San Francisco. I can go work in this tiny little town in the Adirondacks, and it's amazing. And they're happening everywhere. And they're called Zoom towns, right? The towns that are popping up because of Zoom, because now I can work from anywhere. And, this whole piece around what can be delivered instantaneously and how easy it is. So, there's a lot that's going to shift on how we show up. But I think that when we can walk out again, I'm a firm believer in humanity. And I think that people are so desperate for each other and for connection, that I think that level of connectivity that people are going to expect from one another, from their employer, from their coworkers, is going to have a level that we haven't even thought, or hit a level that we haven't even seen yet. Yeah. So, think about where are the places you can insert humanity to the best of your ability during the situation that we're in right now, because it'll be different next week. But if you keep asking yourself that question, I think we'll end up in a good place.
Yeah, I love that.
Even humanity.
And there were so many misconceptions about working remote in general. I mean, it was believed that people would be less productive at home, but that's been proven wrong already.
Right.
People are more productive. So you're right. That's a great thing to ponder. What will it look like when we return, or if we return to office spaces?
Well, and that flip side, right? Yeah. That flip side of now everybody's at home, right? Or so many people are at home. I shouldn't say everybody's at home. So many people are at home.
Right.
One of the things that we were talking about not that long ago is, you've had human resources departments and experts for years trying to help people figure out how to have a work-life balance to save people from work. Right? I think we now have to start thinking about how do we create space for people to walk away from home, right? How do we create space for people to walk away from home? Because now home is everything. So it's going to be a curious future for us.
I do agree. We've had some team members who have asked to work remotely from different states, and we're encouraging that. I mean, do that for your own mental health.
For sure.
Yeah, we shouldn't all be locked up every day, all day. Let me ask you this. What should CEOs be most focused on right now during all of this?
So I am a firm believer. I mean, I've spent my career in customer experience, right? I've spent my career in customer experience. And when I think about CEOs specifically within healthcare, specifically within healthcare professional delivery organizations, we know that 33% of consumers would have switched doctors in a heartbeat for a better experience pre-COVID. That number, I believe, is only going to increase. Right. So if you think about what people are focused on as they're trying to navigate their life, right? That's 1 in 3 people. They're not switching for cost or quality of care. They're switching for experience. And experience is ease. How easy was it to do business with you? How helpful were you to me? And how enjoyable was our interaction? So if there's anything I think CEOs should be focused on right now, enjoyability is a whole nother chat, right? We can talk about enjoyability in healthcare for days. We can do that later. But ease and helpfulness, if you're not tackling those 2 things right now, you're going to lose people that you serve because they're going to go to someone who's figured out how to be easier to do business with, even in this telehealth age, and more helpful over a video camera.
Wow. I mean, that's a powerful message, and it needs to resonate with everybody that's listening to this.
Those are the drivers. That's what makes people choose things regardless of industry. You know, I've been testing that theory in healthcare for 20 years, and I'll tell you, we've not found anyone who's been able to disprove it. Those are the 3 drivers. So
your passion for experience comes through very easily. Anybody listening or watching this is going to know that. You're also very passionate about another project called Aubrey Answers.
Yeah,
and I would love to know a little bit more about that. Please.
Thank you for asking. Aubrey Answers is a total passion project. It's all volunteer run. It's just this beautiful thing. So one of the ways that I made my name in healthcare, other than design of products and design of experiences, was I went after language in healthcare. Long, long ago in a galaxy far, far away, when we were starting Definity Health, we did some research and we realized that one of the top 3 reasons people didn't trust healthcare, so pharma, provider, I mean, the whole ecosystem, was the language that healthcare used. So we did a ton of work in translating all of that language to language that people would understand, right? Things like over 50% of Americans believe that coinsurance is the insurance their spouse has. I mean, there's so many stats. 82% of people think provider is not the doc, but the insurer. Anywho, so we did a lot of work on simplifying the language in healthcare, and we're pretty well known for it. We help companies translate and transfer that knowledge to them so they can speak more plainly to the people they serve. And then COVID hit. And I love the CDC and I love the WHO, but they are not fabulous at talking to consumers about complex stuff. And so we launched www.aubryanswers.com. It is ad-free. It is all free resources. We have contact tracing tools. We just launched a risk calculator. We have pretty much answers to every consumer question that we can find about COVID. And we've also asked people to write in and tell us their stories about their experiences with COVID. So lots of great hints on how do you prep? What do you do? What does a quarantine look like? If you start to feel sick, what should you do? What are the things you should have stocked up and ready? What's a pulse oximeter?
Right.
So just a ton of free resources out there for consumers, because frankly, we just weren't finding anyone else who was taking such a complex and scary thing and translating it to plain language at a 5th grade level. So that's what we did. Is that crazy?
Gosh, I mean, talk about something the world needs, right? Oh.
We just, a trusted source that's understandable.
Right.
It didn't exist. So, we've got a bunch of great writers from all sorts of healthcare institutions and public policy people. And, it's a really beautiful, beautiful piece of work. So, encourage anyone to go and share it with anyone that you serve, because it's pretty easy to navigate. And that's what's important. It's easy.
Yeah. And I feel you're probably just continually adding more and more resources as you go, and
constantly. And every time the CDC changes a guideline, we go back and we edit and retrofit and update. So, initially it was, you can't bring anything into your house. We've now started talking about that's probably not how this spread is happening. So here's what you can do. But we're trying to stay on top of it as much as things are changing. But thank you for asking. I really do appreciate it, Daniel.
No, generally, I mean, passion projects are always the best. I love that. And especially something with a mission like this. That's all.
Plain language, right? Plain language and clear information. Such a mission.
I know. And just to reiterate one more time, the website is aubreyanswers.com. Is that correct?
You got it. Aubrey with a B as in boy, aubreyanswers.com.
In closing, is there anything else you'd like a CEO or a physician out there to know? Maybe we haven't covered?
You know, I wrapped this webinar that I did of physicians not that long ago with something very similar, and it's just gratitude, because what you're doing right now is something that I think as a consumer and just a human, I appreciate an enormous amount. And CEOs, keep your people as safe as you can, right? It's a tough world, right? We're asking people to do incredible work in a really incredible situation. And then here I am saying, oh, and yes, you have to be easy and helpful and enjoyable while you do it. So I understand kind of how attainable this can feel some days. And frankly, I just would always end with my appreciation for what you do.
Thank you for joining us on the Healthcare CEO Show. If you've enjoyed this episode, don't forget to subscribe on your favorite podcast platform for more insights from the top. Until next time, lead boldly and care deeply. See you on the next episode.